Okay, so seeing as we are recording this, I think we can go ahead and get started, and I will distribute it to the other participants that will be joining us so they can get up to speed. But thank you both, Nikki, Chaitra, for being here within the weeds today from the Mass Health Connector. A quick disclaimer, we are recording this for distribution, so if you want to keep your video off, 100% able to do that. We will be moderating the Q&A for questions at the end. Please keep in mind to keep any personal information outside of specific questions such as income or health problems or things of that nature. The more general the topics, the better, and we'll be able to dig in to answer those for you as possible. In the Weeds, we are a national 501c3 public charity that is locally based here in Boston. We champion the physical, financial, and mental health of the hospitality professional, and I am so humbled that we partnered with the Mass Health Connector on the new plans from the American Rescue Act that fill all those buckets in one way or another. So without taking too much more of anybody's time, I think we can jump right in. And Nikki and Chaitra, if you want to introduce yourselves and kick it off, we can go ahead and start.
That's great. Thank you so much, Al. My name is Chaitra Sanders. I'm the Associate Director for the Health Connector for Business. And Nikki, would you like to introduce yourself?
Sure. So I'm Nikki Conti. I'm the Associate Director of Public Outreach and Education of the Health Connector. And we're very glad to be here with all of you today.
Yep. And so today, Nikki and I will be presenting for you on health insurance available to both individuals and small groups through the Massachusetts Health Connector. And so we'll be taking turns on presenting on those items. I'll be talking mainly about small group offers, what employers who own small businesses can offer to their employees. And then Nikki will be talking about plans that are available to individuals that might not have access to coverage through their employer, or for whatever other reason that they are unable to get health insurance from any other resource. So what we'll do is start with a little bit of an overview of what the Massachusetts Health Connector is. And just to let you know, the Massachusetts Health Connector is actually the state's health insurance marketplace. So we are the state marketplace in Massachusetts. And what we do is we offer individuals, families, and small employers access to affordable health insurance coverage. So as I said, I am going to speak a little bit about what small businesses in Massachusetts can offer through the Health Connector for Business to their employees. And Nikki will speak a little bit more in depth about what individuals can get if they do not have access to health insurance through a job or any other source. So they could apply for individual coverage. We'll also be both speaking on the American Rescue Plan and what those changes will offer as far as more savings for those who apply for individual insurance. And just to let you know, we also don't just offer health insurance, we also offer dental insurance through both the individual and the small business marketplace. So I'm going to just briefly speak on the American Rescue Plan. Nikki will go a little bit more in depth on this, but a lot of you have probably heard about the American Rescue Plan. It was signed into federal law in March of 2021. What the key takeaway here is about the American Rescue Plan is it is really providing financial help for health insurance available to many more people. So those who already get help paying for health insurance through the Health Connector could possibly save even more. And those who may have not qualified before for health insurance, for help paying with health insurance, could now possibly see lower monthly premiums. Now on the Health Connector, both on the Health Connector and the Health Connector for Business, we want to let you know that any of the plans sold through the Health Connector meet the state and federal standards for coverage. So that's very important for you to understand. There won't be any tax penalties for individuals who get a health insurance plan either through the Health Connector or the Health Connector for Business. All of the plans, both health and dental, sold through the Health Connector are qualified health and dental plans. Now, Nikki's going to be talking about those health plans that are available with advanced premium tax credits. And again, she'll be talking about the possibility of more help or higher tax credits through the American Rescue Plan that it may be available, as well as our connector care plans and the catastrophic plans available. Again, dental plans are available both through the individual platform for children and families and individuals, as well as through the small business platform. Health Connector for Business, which is what I'll be discussing in a few seconds here, is the health insurance available for small businesses here in Massachusetts that have 50 or fewer full-time equivalent employees working on their wage report. Okay, so a little bit about Health Connector for Business. So again, Health Connector for Business is the state marketplace. It is the small group state marketplace. And what we do is we allow for small businesses in Massachusetts with 1 to 50 full-time equivalent employees the ability to shop for plans through the Massachusetts leading insurers. We focus on exclusive cost savings and flexible choice benefits. Now, when we speak about the leading insurers, these are the leading insurers both on the Health Connector for Business and on the individual and family platform. And as you can see on the screen, here are some of the here are all the logos of the health plans that we offer through the Health Connector. So some of these or all of these may be recognizable to your familiar. They are available through Health Connector. So let me speak a little bit about some of the benefits that are available by shopping as a small business through the Health Connector for Business. So if you're a small business with 1 to 50 full-time equivalent employees, what the Health Connector is trying to do is we're trying to seek to maximize access and affordability for you to provide health insurance to your employees, while actually providing the employees with a range of offerings that fit what best suits their family and their financial needs. So what we would like to tell you is there are lots of benefits. These are the 6 key benefits that we found that is available for shopping through the Health Connector for Business. One thing that I could point out is this is a one-stop shopping solution. So as a small business coming to the Health Connector for Business, what you are going to find is this is the only place where your small business can actually access every single leading insurer, like we showed the logos before, in the health marketplace here in Massachusetts, as well as the Altus and Delta Dental. It is all online, so very easy to shop and compare plans, offer plans to your employees, have employees shop, do billing, review plans, renew, everything is online. So it is a one-stop shopping solution. We try to make it as easy as possible for you as a small business owner or manager to go through the process of offering health and dental insurance to your employees. We also have competitive premiums. What small businesses who have shopped on the Health Connector for Business have found is they actually can save over 20% on average by shopping through the Health Connector for Business. This is before any of the rebates that I'm going to speak about. The reason that businesses find that they can save 20% on average is they're coming to one location to look at all of the plans available to themselves and their employees. And that gives them the opportunity to compare plans. They can use a quoting tool to compare these plans, a broker, or everything is accessible to them right there, so they can make a financial decision on what best is for their budget as far as health insurance, for health and dental insurance for their business. There's also wellness rebates. Our wellness program, which is called Connect Well, offers employers the opportunity to receive back 15% on what they contributed into their employees' health insurance premiums over the year if 33% of those employees can actually complete one of the 30 pre-approved wellness activities. So that's an opportunity for employers to receive money back for offering employees, enrolling employees on health insurance, and also at the same time promoting wellness within their business. And I'll talk a little bit more about that also. We also have a program called Employee Choice Models. And that is the flexible employee choice model that we created, where it allows for employers to control their budget while allowing their employees to shop for different plans that best fit the needs of their family. So an employer is able to create a plan that's constant as far as their costs, and then allow for the employees to make the decision on which plan that they would like to enroll in based on their healthcare needs and obviously what they can afford for their family. Also, to let you know, utilizing the Health Connector for Business is free besides paying the premiums. So there are no membership fees or dues to utilize the Health Connector for Business. And there are also over 420 certified brokers available for free to help you as an employer decide which plan options are best for your business. So just remember, it's free to utilize the Health Connector for Business. No membership fees, no dues, no paying a broker to help you decide on what to offer your employees, just the premiums need to be paid. And as stated before, all health insurance plans sold through the Health Connector and the Health Connector for Business meet federal and state coverage requirements. So you can have a peace of mind as an employer that you are offering your employees benefits that will not cause them any tax penalty when it comes time to do taxes. So I stated before that we have this exclusive model called Employee Choice Models, and that is only offered through the Health Connector for Business. And the goal of the Employee Choice Models is to allow for employers to control their costs, so create a budget plan, while providing multiple insurance options to your employees so that the employees, can actually compare the options that are available to them and choose a plan that best fits their needs. Those employee choice models are called one plan, one carrier, and one level. One plan is where you as the business owner, manager, the HR person, whoever it is that's making the decision on what's going to be offered to the employees, this would be you making the decision for everyone. So one plan is where, as the decision maker, you actually decide what carrier you're going to offer your employees, what plan from that carrier you'll be offering your employees, and then how much the business will be contributing. In the end, the employees who need health insurance will be able to enroll in that one option. So that's not much of a choice for the employees, but it is a choice for you as an employer if you'd like to offer the one plan. Now, one carrier is where you as a decision maker decide what carrier, what insurance company would you like to offer your employees access to get plans from. Then you'll decide which plan within that carrier you would like to contribute a percentage amount into. So that would be controlling your costs. You would make that decision, this is the plan from this carrier that I would like to contribute into. Then your employees will have the option to either go ahead and take the plan that you put as the contributing plan, or buy outside of that plan and buy a different benefit tier from that carrier. Therefore, allowing your employees to make the decision on what benefit tier they would like to have access to and enroll in. So benefit tiers, just to let you know, just describe a little bit about the out-of-pocket costs for services. So they're platinum, gold, silver, and bronze. The higher the metal tier, the higher the premium, but the less out-of-pocket cost when you receive the point of service. So that's one carriers where you as the employer is selecting who the carrier is going to be, contributing into one of their benefit plans, but then allowing your employees to make the decision what benefit plan best works for their family and paying the difference outside the one that is being offered by your business. One level is where you as a decision maker will decide what benefit level you're going to offer all your employees. So as I stated before, the benefit level is the deciding factor on the amount of money that's kind of put out as co-pays, deductibles, co-insurance, points of service. So you would decide that for all the employees. Then you would decide which plan from what carrier on that benefit tier you would be paying your contribution into. Then the employees can go ahead and take that contribution that you're putting into the plan that you set as your budget plan or your reference plan, and put that amount of money towards any of those plans from that benefit tier based on the carrier that has their doctor in the network. So in this case, what you're allowing your employees to do is you're allowing your employees to pick a carrier that has their doctor in the network. But if if the business can only afford a certain plan from a certain carrier, that is the one that you are controlling the cost at. So those are the employee choice models. And as a business, you can offer any one of those at initial enrollment. And if so you want to change that at renewal, you can. Now, I stated that I talk a little bit about Connect Well. Connect Well is our wellness rebate program. It is designed for businesses who have 25 or fewer enrolled employees on the Health Connector for Business. And it's a pretty easy rebate program to participate in. To participate, the employees actually get to choose from anywhere from 30 pre-approved qualifying wellness activities. And if 33% of the employees who are enrolled actually successfully participate in one of those 30 pre-approved wellness activities, the business will actually receive back a check for 15% of what they contributed into all the employees' health insurance premiums over the year. And what we found is in 2020, the average Connect Well rebate was about $2,900. That is based obviously on how much was the average that an employer was putting in. So the more that an employer contributes, the larger the Connect Well rebate will be at the end of the year. Now, of course, employees are also incentivized to participate in one of these wellness activities, and their participation, if their activity that they submit is approved, will be a $100 Visa gift card. So just to review, like I stated, there's 30 pre-approved wellness activities. We also have activities that can be completed at home, in case people aren't going to gyms right now or anything like that. There are plenty of opportunities to have access to one of the wellness activities that could get approved. And they are focused on mind, body, and money. So mental, physical, and financial health. These are just a few of the samples of what could be approved as a wellness activity if your employees participate in it. So, under mind, we have things like volunteering, acupuncture, yoga. Under body, we have a gym membership, community garden, going to the doctor for your well visit. And for money, financial literacy, student loan planning, home buying course, and there's many more. Like I said, there's 30 pre-approved wellness activities. On our website, we'll give some information on what is approved or not approved. And also, we also give some resources on where employees could possibly find some of these activities if they're not sure what to participate in. So very easy for them to get their $100 Visa gift card, which is a great incentive for them to participate in this. And for you to get 33% of your employees to participate in this and actually receive back 15% on what you contributed towards the year. So there's also a small business healthcare tax credit. So the small business healthcare tax credit, just to let you know, is a federal tax credit. And small businesses that offer health insurance through the Health Connector for Business may be eligible for up to a 50% tax credit. Now, there are some eligibility requirements on here that employers must hit. The first and key one is that their business has to be enrolled through a state marketplace. The Health Connector for Business, as I stated before, is the state's marketplace for small businesses. So that is a requirement. If they hit all of the other requirements, such as, you know, having fewer than 25 full-time equivalent employees who have average wages of around 53,000 a year or less, offering at least 50% of the coverage, and they offer it elsewhere, not on the Health Connector for Business, they wouldn't even be able to talk to their accountant about this tax credit. So what I always say is, if you're offering health insurance through the Health Connector for Business, you should be talking to your tax preparer, your accountant, your financial consultant about this small business tax credit to see if you're eligible to enroll, to get this tax credit. So now that we've spoken a little bit about the Health Connector for Business, the benefits of utilizing it, the money back, the employee choice miles that you can offer your employees, now you're probably thinking, well, when can I enroll? Now, Nikki is going to talk a little bit about open enrollment period and a closed enrollment period and an extended enrollment period. That's on the individual side. For small businesses, just to let you know, there is no closed or open enrollment period. A small business can apply to offer health insurance to their employees the first of any month during the year. So for instance, if right now you wanted to start looking at offering your employees health insurance on July 1st, let's just say that's what you were looking at. You would come to our website, www.mahealthconnector.org/business. And then what you would want to do is you do have to hit some deadlines in order to become active for, let's say, like I said, for example, you wanted to enroll everyone for July 1st. So if you wanted to enroll everyone for July 1st, by June 10th, you would actually have to online create your employer account and offer your benefit package through the online account by June 10th. That opens shopping, or in this case, you could call it open enrollment, for your employees. Your employees would then all receive emails to let them know that your business is offering them health insurance through the business, and they would then create employee accounts, look at the offerings, and would enroll no later than the 20th. So in this case, if they wanted to become active on July 1st, they would have to enroll or waive with a valid waiver by June 20th. Once that's completed, we create an invoice, and that invoice needs to be have an online payment made by the 23rd. So again, this would be, in this case, July 23rd if you wanted, June 23rd if you wanted July 1st coverage. And then as long as those deadlines are hit, coverage will begin on the 1st of the month. And again, that is good for any 1st of the month for the year for small businesses. And the renewal comes on the anniversary date the following year. So it's not a calendar year, it's not any kind of permanent set year. If you enroll on July 1st, you renew next year on July 1st. You enroll June 1st, you renew next year on June 1st. So you get a full benefit year to offer your employees. Now, earlier in the presentation, I did mention that there are benefits of utilizing a broker. I stated that they were free to utilize. So on the Health Connector for Business, we actually have over 420 certified brokers. And yes, they are free for you to utilize for Health Connector for Business related any kind of options through there. Now, why would you want to utilize a broker? You don't have to utilize a broker. We have a self-service model. It's very easy, it's online, like I said, but you're probably very busy doing things that you have to take care of for your business right now. So utilizing a broker, they can easily put together cost estimates for you, present them to you, and show you the different plans without you even actually having to create an employer account. You can do that after they present it to you and show you what's available to you on the Health Connector for Business. Also, just to remind you, this is what brokers do for their livelihood. They are experts on insurance, both health insurance and dental insurance. So when they're going to compare available plans to you, they're going to understand which one is the best for your group based on what you guys discuss. Also, utilizing a broker will save you time. Right now, you're probably focused very much on your business, the restaurants, getting, your customers happy and everything. So the brokers will take the time to manage the whole enrollment process, the plan creation, helping your employees enroll. That way you can spend more time on what's important to your business. And now, finishing up on the Health Connector for Business, I'm going to flip this over to my associate, Nikki Conti, and she can talk a little bit about what's available to those employees, or maybe even yourself if there's no health insurance available through your business, through the individual and family market. Nikki?
Great. Thanks so much, Shaitra, and thanks for sharing all that information about Health Connector for Business. And as Shaitra mentioned, if you are listening to this presentation because perhaps you're wondering about coverage options for some of your staff members, or you might be in a position yourself where you and your family manage your small space, your small business, and thinking, okay, is there another way for me to get coverage? So I'll talk about the individual and family side of the house. And as I'm doing that, I think one thing I want to start off with is just really explaining some of these new benefits that are available to individuals and families through the American Rescue Plan. So as Shaitra mentioned, there's more help paying for monthly premium costs through the Health Connector. And again, this essentially means that people who are enrolled in our individual and family plans on MA Health Connector, mahealthconnector.org, can get access to these additional dollars. So in the past, people whose income may have been too high to qualify might find out that they're now in fact eligible. What has happened is, instead of an income limit for financial help is going to be based on affordability. And the help is coming in the form of tax credits. And those lower the monthly cost of plans so that they are available for people at any income level if a plan costs more than 8.5% of their income. I've already said that people only qualify for these savings if they enroll through the state's marketplace or through the Health Connector. And we are working really hard on a new tool that's going to let you preview these plan costs to see whether or not you want to even complete an online application for help. That application is a little bit longer. So you may be wondering, okay, is this something for me? Can I in fact get some savings? So that tool is in process, and we will certainly let all of you folks know. We'll certainly be reaching out to Elle when it is in fact available, so she can let you know as well. And then, of course, there's another provision of the American Rescue Plan, and that is people who received unemployment income, basically at any point in 2021, they are going to have access to low or no cost Health Connector or low cost connector care plans through the Health Connector. So we're really happy to be able to say that we're working to put these items in place. Many of these things are already implemented. The last piece that we're working on, or last two pieces actually from this bulleted list, we're working on the new, you might want to call it a cost estimator tool. And we're finalizing our plans for how we're going to help people who got unemployment income in 2021 gain access to low or no cost connector care plans. If you may be thinking to yourself, okay, yes, Shaitra mentioned that the American Rescue Plan passed on March 11th. So staff have been working very quickly to make all of this a possibility and a reality. In addition to what is available through the American Rescue Plan through the Health Connector, we also want to acknowledge that there's new help paying for COBRA. So one of the provisions in the law was that American Rescue Plan includes help with COBRA payments to make employees cost zero. So that $0 monthly cost is only available from April through September of 2021. So this is if you're thinking about staff and whether or not they in fact could be eligible for these $0 premiums. This again would be something that they would be getting through their employer, through you. So you want to, seek some counsel on this if in fact you are offering COBRA. For some people, it may, if they're already on COBRA, it may be best to keep the COBRA or enroll in COBRA. For others, it still may be better to not elect in COBRA and come to the Health Connector. When you're thinking about that, the cost of health insurance, I think we all know, is not just monthly premiums, but you also want to take into consideration what people may be required to pay in deductibles or copays on services that they need or prescriptions that they pick up, etc. So it is certainly a decision that someone in this situation might want to weigh their options before making a final choice. Now, one thing you might be keying in on is the fact that these subsidies are going to end in September of 2021. So in order to help people at that time, if someone chooses to go on COBRA, they're going to have the option to enroll through the Health Connector when their subsidies end. So basically losing their help paying for COBRA is going to be considered a qualifying life event that lets somebody enroll outside of the state's open enrollment period. And I'll talk about open enrollment. But before I do that, I want to share some sample premium savings that Massachusetts residents may be able to see based on their age and what part of the state that they live in. So I think that's really, really important as you're looking at this in talking to, talking to your friends, colleagues, your employees. They may be in an area of Massachusetts and an age group where they could see some savings. So for example, I'll take a look at the box for the 50-year-old in Worcester. So let's just say right now their income is approximately $44,660. When they applied through the Health Connector, they were eligible for Health Connector plans with advanced premium tax credits, and their monthly premium before the American Rescue Plan was about $371.58. Now, because of the American Rescue Plan, they are at $269.82 a month, and they've saved about $100 a month. So that is really, that's pretty fantastic. Now, in contrast, let's say you are talking with a 30-year-old who lives in Boston and their income is about $30,000 a year. So if they applied for coverage with us, they would be found eligible or could be found eligible for a Connector Care Plan Type 3A plan. So that monthly premium is already pretty subsidized. It's $89 a month. So when we look at that person's eligibility again, the American Rescue Plan is actually giving them they're still giving them savings, but their monthly savings are about $13.09 a month. So still a savings, but as you can see, going from Boston to Worcester, the different age, it is a difference. So I won't go through the details for the consumer in Great Barrington, but I will note that when you're working, if any of you are working on the Cape or the islands, the cost of coverage is a bit higher in that location. So here we've got the sample 45-year-old in Nantucket, and they weren't receiving any subsidies in the past for their coverage. And now with the American Rescue Plan, they're seeing well over $280 worth of savings. So do keep all of this in mind as you are thinking about, what these savings really could be. So for individuals and families, if you're thinking, okay, who should apply? First of all, we're speaking to or thinking about Massachusetts residents only. Those are the folks that can apply through mahealthconnector.org. People need to be a U.S. citizen, U.S. national, or otherwise lawfully present in the United States. And in order to gain access through our coverage, they have to be in a position where they don't have health insurance. So if someone is already enrolled in Medicare, the state's Medicaid program known as Mass Health, or they have access to any other type of public health coverage, they wouldn't qualify for coverage through mahealthconnector.org. Also, if someone's offered affordable comprehensive health insurance from their employer, they wouldn't qualify for coverage and subsidies through mahealthconnector.org. And lastly, of course, you'll see if someone is in jail or incarcerated, they wouldn't qualify for help through us. Now, Shaitra and I both mentioned open enrollment slightly in conversation. So I just want to talk a little bit about that, because that may be something that you don't necessarily, maybe not necessarily be a term that you are familiar with, or it's just not in your everyday lingo. So essentially, open enrollment is a time of year when someone can apply for new coverage for the coming year, or renew their coverage, or simply shop for a new plan. People don't need to have any special qualifying life event in order to become eligible during this time frame. It's basically an open window or an open door. Now, because of COVID-19 and basically everything that's happened with the pandemic, the Health Connector has been in an extended open enrollment period. Our open enrollment period is usually from November 1 through January 23rd. However, we've extended through July 23rd this year. So if you are in a situation, you're watching this recording of today's session, you're talking to staff, family, friends, whomever, just encourage them. If they do not have health insurance, this is the right time to apply for coverage and see what they qualify for. If someone is found eligible for a Health Connector plan, their health or dental coverage can start as early as the first day of the following month, if they would like. Now, if someone is in a situation where they need coverage sooner, again, encourage them to apply right away, because it may turn out that they don't qualify for Health Connector coverage, but rather they qualify for Mass Health coverage, and Mass Health does in fact start sooner. So everyone's situation is different. We know sometimes that there's stigma associated with, with state or government health plans or government services, but really at this time, I think we are trying to convey that having coverage, being insured, that's ultimately the goal here, so that people can, seek services when and if they need them. So moving on with these slides in terms about applying for coverage, you may be wondering how people do this. And there are a couple of different ways. You can apply online at mahealthconnector.org. We have a fully functioning Spanish website, mahealthconnector.org/ES. People can also apply over the phone, or they can apply with the help of a partner community organization at local organizations, and also the health centers can help. There is one application to find out if you can get coverage through the Health Connector or through the state's Mass Health program. And just openly want to acknowledge that when you do apply for coverage through mahealthconnector.org, you will get a letter from Mass Health, and you'll get a letter from the Health Connector. We're just legally required to send you those things that will tell you if you in fact qualify for the Health Connector. You'll get a letter that says you don't qualify for Mass Health. And conversely, if you qualified for Mass Health, you'd get a letter from the Health Connector saying you don't qualify for Health Connector coverage because you qualified for Mass Health. So things people need to gather when applying: Social Security numbers for everyone who's applying if they have them, immigration documents for any non-US citizens. We have a link on this presentation that goes to our website. So if anyone's, they have immigration documents, but they're not even quite sure exactly what's what, you can compare and contrast that information to what is on our website. And really important here, When you are applying for coverage, we're going to ask you information, or we're going to ask you questions about income. We'll ask questions about someone's current income. We'll also ask questions about someone's projected income for the whole year. So I know this is a tricky time and people don't necessarily have crystal balls, but if somebody is working, we'd say gather your last couple of pay stubs. If someone is collecting unemployment insurance, we need to know what the monetary determination is. If someone has their letter from unemployment insurance, that's great. If not, and they go into the unemployment insurance, the Division of Unemployment Assistance website, they can also see that amount online. If somebody is self-employed, so if you are a small restaurant entity, and not sure if any of you are set up this way, but let's just say you are a sole proprietor and you're set up as self-employed. We just need to understand what your net income is. Now, like I said before, we don't want people to unnecessarily go without coverage. So if you don't have all of this information with you, we would still encourage you to start this process and get going. The state will send you letters asking you for any other information it needs to help make a determination if we're not able to with what you've shared with us. So, in a lot of ways, it's best to gather as much as possible. And then certainly you come back into the application, update information. You can also, keep an eye on your mail. If we need something, we'll reach out to you. In particular, if your income goes up or down, come back to the application and update the application. So Shaitra briefly mentioned that there are two kinds of help available paying for coverage through the Health Connector. There is advanced premium tax credits, and through the American Rescue Plan, people now have access to more of them. And essentially, these tax credits lower the monthly premium amount people pay each month. And those dollars don't come directly to you, but rather the IRS sends the tax credit directly to the insurance company, and the person simply pays less each month. As a consumer, you need to choose if you want to apply some or all of your tax credit to reduce the monthly premium payment. Now, separately but related, we have this Connector Care program. Now, this is unique to Massachusetts, and it uses the federal advanced premium tax credits plus state dollars, and those two things help reduce the monthly premium to the low premium that it is. Now, important with Connector Care, if somebody qualifies, that means they'll have access to low monthly premiums, low out-of-pocket costs, no deductibles. And depending on the plan type somebody qualifies for, they can choose for a plan with the monthly premium as low as $0 to $133 per month. Now, you might be wondering, okay, who's going to get access to these advanced premium tax credits? Who's going to get access to that Connector Care program? So for the Connector Care program, there are income limits. So those income limits are set at 300% of the federal poverty level. So in real dollars, what that means is if you are a family of two and you are making $51,720 or less, you could qualify for a Connector Care plan. Or you can see family of four, $78,600. Now, when you're thinking about the advanced premium tax credits, you want to think about this a little bit differently. Before the American Rescue Plan came along, we were capping advanced premium tax credits at 400% of the federal poverty level. What the American Rescue Plan has done, it's removing that 400% cap. It's removing that income limit. So this month, if somebody has more than 400% of FPL, they may in fact qualify for advanced premium tax credits because instead of having an income limit, people are going to qualify for those additional savings, those additional advanced premium tax credits based on the affordability of the health insurance plans that are available to them. So those advanced premium tax credits are going to be available to applicants to lower their monthly cost of health plans so that they aren't paying more than 8.5% of their annual income. So I know that's a lot to take in, but as I mentioned, we're working on a web tool that can help somebody estimate the cost and estimate their own situation to see if they could in fact qualify. I'm just, checking here. It's looking like that tool is going to be available mid to late May. But if you're someone who's in a situation that needs coverage right now, again, I would encourage you to apply now, seek the financial assistance. By seeking the assistance, if you get determined eligible, there is no requirement to take that coverage. You could just look at it and weigh your options. Now, just like Shaitra mentioned, that on the Health Connector for Business side, there is free help available through Health Connector for Business customer service. There's free help available through Health Connector for Business health insurance brokers. As she said, those are certified brokers. Now, on the individual and family side, I want to acknowledge that there are similar types of free help. You can get help with this process through our customer service, and all the information is listed there. We're at 877-623-6765. And then you can also seek assistance from community partner organizations. So these are folks who are trained and certified by the state. Right now, during COVID-19, during this pandemic, many people are still seeing people virtually. So they're doing telephone calls with people or Zoom webinars, whatever your preference is. And you can find people in your community. And if you want, you can establish a long-term relationship with these people. So we'll show you, we'll give you the complete link, but essentially you can click there where it says get free help near you. And you can type in your zip code and see who is available in your community, make a phone call, set up an appointment, and they can get you started. So as we're nearing the end of this and, looking forward to answering some questions that you may have, here are just a few reminders about shopping and getting coverage through mahealthconnector.org. Keep in mind that small business owners, small employers and owners that don't qualify to offer coverage on Health Connector for Business can come over and get coverage on the individual and family side at mahealthconnector.org. You just need to apply, enroll, and pay your first premium by the 23rd of the month before coverage can start. So there's certainly time to apply and enroll and pay by May 23rd for coverage to start on June 1. Just a little technicality here. If you wanted your coverage to start on July 1 and you applied now, you can also choose that start date. And I'm hoping this last bullet here is a point that I definitely drove home, is that there is free help available to help you through this process, whether you haven't applied at all, or maybe you have applied and you've run into some problems. We can certainly connect you with some resources that can help you go through this entire process. So with that, I would like to get my coworker, my colleague Shaitra back online, and also maybe turn to Elle so we could take some questions or maybe just have some discussion during the recording so that anyone that is watching this recording later maybe has access to a little bit more information. So I will turn this back over to you, Elle. Thank you.
Thank you so much, both of you. So informative. And like I said at the beginning of the presentation, In the Weeds mission is to champion the physical, financial, and mental health, and the options that the Health Connector have presented sort of fill all three buckets, which is a really, I think, wonderful amenity of living in the Commonwealth of Massachusetts to have access to all of that. I haven't seen any questions come up in the chat. If anybody on here has any questions of what was covered that we can answer for you, be happy to do that. Anybody who is watching this post presentation, either on the YouTube or on the Mass Restaurants United resource page, if you do have any questions, you can feel free to reach out to me directly at holler@intheweeds.us, and I can make sure that we get our trusted advisors to help us answer those for you. Any questions there from the team? Okay. Well, I think that's the proof that it was an extremely comprehensive presentation. That's always a good sign, right? So with that being said, thank you, Shaitra and Nikki, so much for being here. For those independent operators and managers and HR people that are watching this over the course of the next week, please share with your staff that we will have a similar presentation that is geared for individuals in English next Monday, May 10th at 2 p.m. Eastern. And then we'll have that same presentation on Monday, May 17th for individuals at 2 p.m. in Spanish. So you'll have seen the wonderful resources for small businesses, and we'll be able to amplify that to the individuals to hopefully get, our goal is to get 1,000 hospitality professionals covered by July 23rd, which is the end of open enrollment. So let's smash that goal together.
Thanks for having us, Al. We really
Thank you so much for being here. Really appreciate it.